Welcome to Bite Size Dental Marketing. Today we have Shelley Bostrom with us. Shelley, thank you so much for joining us again. Nice to see your face, and I'm ready to talk about how to hold your team accountable.
Such an important
2024.
topic.
Well, we were talking on the pre-show. Many of our offices they would not characterize it, but they're scared to hold a team member accountable, not for fear of the conflict, but for fear of, having to replace someone or having someone leave. And it is challenging in the labor market today. And you were mentioning that you were in Arizona speaking at a conference, and this felt like a good time to bring this topic up as we get into 2024. But welcome back. I'm so grateful that you're here.
Thanks, Eric. I'm super happy to be back. And we had such a great time chatting last time. And I always enjoy catching up with you. And yes, this topic of team accountability is a big one, I would say, for the huge majority of my clients. And yes, I just was in Arizona at the Arizona Orthodontic Study Club. And we had two topics. And this was the first topic of choice, chatting with all the doctors and really talking about that team accountability and how doctors can really elevate the performance of their team and kind of remove themselves from the day-to-day operations. And I think a lot of doctors don't feel like they can do that, but then I put that back on the doctor or back on the office manager. You really need to make sure that you are holding your team accountable. Not that I want to compare practices to like parenting, but I have 3 grown children, but when they were little, I needed to make sure to hold them accountable. And if I was going to ground them, if they didn't do this and they didn't do that and I didn't ground them, it's similar. You need to make sure that when you put your operational systems in place and expectations on your team, that if they don't perform, there needs to be some sort of a consequence.
There you go. That was my question. What does holding someone accountable mean to you?
So I think in order to hold someone accountable, you need to make sure that you have very clear expectations from the beginning. I remember one of my clients called me and he was so frustrated and saying, "Shelley, I'm so frustrated. I came in this morning and they didn't even take the trash out. And there were empty trays of instruments sitting in the lab." And I asked him, do they know that that's their job? Has that specific task been assigned to somebody specifically? And I'm really big on, of course, the team needs to have each other's back. We all need to have pride of ownership. If there's a piece of trash on the ground, everybody should be ready and willing to pick up that piece of trash. But when it comes down to like morning tasks and daily tasks and closing tasks, you really need to have accountability where you set up a checklist. Every morning, you, Susie, need to turn on the lights, put the music on, start baking cookies, turn on the x-ray, run the cold sterile, whatever it is, so that when Susie isn't there, everybody knows what Susie's responsibilities are. So I think step 1 is just there needs to be very, very clear job descriptions, duties, and expectations. And once that is laid out, then I think my second part of that is really consistent and clear communication. Morning huddles every morning, monthly team meetings every month. Make sure that those things are happening. I also like leadership meetings. So that's going to be different in every office. So maybe the doctor, the office manager, your clinical lead, and your either like your TC or your front office lead,
right.
And have those conversations as well and lay down those foundational rules and policies of your practice. And, if Martha is the only one that doesn't show up to the morning huddle on time and you're frustrated, well, hold Martha accountable. Maybe Martha needs to get written up and realize that the impact that she has for not showing up at the morning huddle is affecting the whole team because she's not prepared to talk about whatever it is that she's supposed to talk about.
Yeah, that's always the one for me is someone's late for huddle and we just tolerate it. And
I hate it.
Yeah. And, the irony is, and this is a quote, I think from Tom Landry, I believe is attributed, but, you encourage what you tolerate. And if I think back on my career as a business owner, that is one of the more good examples of something I wish I would have tightened up earlier. Because I did used to tolerate being late for meetings. I would tolerate someone, for us, I mean, obviously we're a different organization, but there are meetings to where we're going to talk about a specific client and how to improve their marketing, and you needed to prepare for that meeting. But instead of preparing before the meeting, you would come into the meeting and kind of, try to make it up in the first 5 or 10 minutes of the meeting and catch up. And
Right.
those would frustrate me but I didn't know what to do because they were a good employee otherwise. And then there's just this one thing. I knew how to get frustrated, but if I'm being very candid, it was in a very almost passive aggressive, like, oh, Shelley, I wish, it would be a kind of a one offhanded, like, oh, Shelley, I wish you would have prepared for the meeting better today. But then I would never have followed up.
Right.
And now I really did think that was accountability because I was addressing it, but it was in this passive way with no formality behind it.
Yeah.
I wasn't following up. And when it happened, you encourage what you tolerate
Yeah.
on those little things.
Right. Yeah, it's so true. And, I think retaining those great team members is a challenge also, but that also comes with, okay, identifying what's important, what really, qualifies a value team member. And, I've had doctors who are afraid to let people go because they've been part of their practice for so long. Nobody knows how to do what this person
Yep.
does.
Yep.
Well, then that's another problem. That means that I'm a really big believer in having like standard procedure of operations. So if this person is out sick or quits, or you need to let them go, or they're on vacation for a week or two, I always say the show must go on, or the ship must continue to sail.
Mhm.
And you need to have, whether it's in a binder, whether it's in like a Google spreadsheet, if this team member is not there and she's in charge of the lab, then it should be really easy for someone to, you take on, Shelley's duties in the lab. And there should be very clear like guidelines on, you need to call the lab by this time. This is where the lab slips go. There's going to be a pickup at 2 p.m. You need to look at who's coming in tomorrow, make sure the cases are here, all of those things, so that it's super easy just to reassign that person's duties for the day or for the week.
And we have this another one. I wish I had had more confidence or courage to let poor performing team members go earlier, because the team always rallied around and helped feel, as you said.
Yep.
Now, it makes it so much easier when there's documentation. And you said something that's very important to me, is that when you're evaluating to keep someone or not, you need to identify, do I have a person problem or do I have a role problem? Because if you can't backfill them, that they've been there 10 years and no one else knows what they do, you have a role clarity cultural problem in your office. You may also have an employee problem, but if someone can't be replaced, you have a problem.
Correct.
Yeah.
And you're so right. I think very often, I myself, when I was managing a practice, and the clinical lead had been there she was there well before me. She had been there for probably close to 10 years, and she was valuable. She knew how to do everything. And when she gave her 2 weeks notice and was going to move on to something else, it was a scary situation. She was in charge of ordering. I didn't know the names of like, who are the reps? How much do we pay? How often do we order? Do we ask for free shipping? Like, what are the numbers? All of those things. And had I had a manual for, this is what our clinical team lead does. This is what she orders, when she orders. This is what we pay. This is the discount or the code that we put in. All of those things, it would have been a pretty seamless transition to either internally onboard somebody into that role or hire outside of the practice. So I think that was maybe like 15 years ago, my first experience with that, where I was like, okay, that caused me so much stress. I'm never going to let that happen again. So I'm basically creating a manual for every single role within the practice. And so that's what I teach all of my clients to do as well.
When you're talking to doctors today and about holding their team accountable, because no one walks up and says, Shelley, I'm having trouble holding my team accountable, right? What are some of the code words they use or some of the problems that they'll have when they're not?
Really, I do have doctors who say, Shelley, I'm having trouble holding
Oh,
my feet.
really?
Well, oh yeah. Yeah, and they
Oh,
may
they
not
must be
even say
enlightened.
I. They may say, we're having issues with performance. We're having issues with accountability. But that we are may or may not be them, because a doctor may not have an office manager. A doctor may
Right, right.
have, they may be a managing owner. And then I ask the question, are you losing stress? Are you, able to really focus on your patient care? Are you able to grow? And, all of these things. And if they're answering no to any of those questions, maybe it's time to bring in somebody to take care of all that HR stuff that the doctor
Mm-hmm.
doesn't want to do. I remember I had a doctor that was struggling with all of those things. And
Right.
I said, well, why don't you have an office manager? And he didn't want to give somebody the power. He didn't want to give someone the power or that title to be a manager. And I said, okay, well, you don't have to call them a manager. What if you called them an operations director or a practice lead or whatever, and just give them
Mm-hmm.
some responsibilities? You're not handing the practice over to them, but what are things that you could empower and delegate to someone else, that so when you go home, you can focus on your family and you can have a balanced life and you're going to be sleeping and not stressed. You really do need to have a team of difference makers and not expenses, if you will.
Mm-hmm.
So with that, yes, you do need to, step one is writing those job descriptions and clear expectations, presenting it to every single employee so that there is no ambiguity. They know what you expect of them, and then roll it out. They sign it. I understand these are my duties and my responsibilities. And then have maybe a 1 month check-in with them. Don't wait a full year to have a performance review or
Mm-hmm.
evaluation. You need to have that constant communication and kind of nip it in the butt really quick. So doing that within a month and documenting it, as I think you mentioned, yes, you need to have a paper trail. It's going to make things a little bit easier. So I even, like, when I would do my monthly team meetings, I would have all of my topics of everything we were talking about, and I would have everybody sign it. And I would pass around my clipboard and everybody would sign it. And I would save all of those monthly team meeting agendas in a little folder, so that if ever they said, oh, I didn't know I was supposed to do that. Oh, I didn't know this is the new way that we're doing things. I could take out my monthly team meeting. Well, you were here and we talked about it. So that's another piece of documentation too.
Now, and that's how you used it when they signed it. You would bring it out and say, "Actually, Eric,
Yep.
right here I have your name,"
Yep.
and we talked about it.
There's very sophisticated platforms out there these days as far as HR and HR companies. But I think if you have a pretty small practice, it's something you can manage internally pretty easily. Making sure you've got your handbook, your job descriptions, and then really just daily task lists so that you're not forced to babysit and micromanage all the time. You give it to them. It's maybe like a Google Sheets shared document that everybody has their own individual one. And then you can kind of peek in on it and make sure that they're doing what they're supposed to be doing.
Now, when you look out through 2024, 23, 20, over the last 4 to 5 years, so to speak, we're definitely seeing a growing trend toward it is getting harder to run a small organization. And I say small, I would say most dental offices qualify as, small business.
Yeah.
In 2 to 3 million range. Obviously, as costs have risen, which we know they have, I want to spend more clinical time. That gives me less time to work on these style of tasks. I want a good work-life balance. I should start. How are you helping people balance those needs today? I sometimes feel very spread too thin.
Yeah.
In today's economy and today's needs.
Yeah. It really comes down to team. It really hiring right. I have a course. It's Lead, Align, and Thrive. And chapter 1 is how to hire right. It's how to hire the right people. You need to make sure that every person in your organization should, be able to give a commercial for you and really represent you and your brand and your legacy. and represent you the way that you deserve to be represented. So I think really step one is to just hire right. And I do feel that, and I know doctors are going to agree with me here, that it's been challenging. I think coming out of COVID, a lot of people just weren't interested in working, or they wanted to work remote. And so I think it definitely was a challenge. And I believe as an industry, we got into kind of a bad habit of being desperate, and you just literally needed a body in your practice to check the box because we were drowning. It was a really scary time. I do feel like we're past that, and we need to change our habits and not be desperate. Really go through the proper channels and hiring the right people. I always say, do not hire for experience, hire for integrity. You can't teach honesty, integrity, work ethic, genuineness. You can teach the other stuff. You can teach someone how to answer the phone. You can teach someone tooth numbers, how to run instruments, how to take an x-ray, all of those things. So I think initially is you have to make sure you've got the right team. And if you don't have the right team, and I learned this phrase from a doctor client of mine, he said, be okay to free up their future. This world is too small, and even just for that employee, if they're not happy and thriving, this is the way that I would, free up somebody's future is you have a lot of great talents. You're obviously very passionate about what you do, but this isn't the right practice for you where you could really grow and blossom into whatever it is that you want to be, and free up their future to go find something that makes their heart happy and that they love, that they're going to be excited to come to work to, every day. If they're not excited to walk through your practice doors every day and show up and be part of your legacy and raise that bar as far as patient experience goes and be a good team worker and show up on time for your huddles, then you need to be okay knowing that they're not the right fit for your practice. Even if they've been there for like 10, 15, 20 years, it's time for them to start anew somewhere else.
Josh Kaufman had a TED Talk that he came out with and said that you are 20 hours away, 20 very purposeful hours away of learning something. And if you've done it with discipline and purpose, you're 20 hours away from learning something, and you're going to be better than 80 or 85% of the population at doing it. I feel the greatest sin that we make in hiring is assuming that because someone's done it, they must be able to just drop in and do it here. And the truth of the matter is, you nailed it in office, from office to office, and how they treat their patients, and how they talk about insurance or not, how they treat patients, how they hand off with each other, is such a more valuable skill that we're going to hire someone who's an office manager who's done it 10 or 15 years because they've done it, thinking that they must have some secret. And really, you could hire someone from Nordstrom's, you could hire someone that has a really good drive and purpose, and within 20 hours on that topic, they would be effective.
Yeah, so true.
Do you agree with that?
I've actually hired, and I encourage my clients, if they're looking to hire, I said, just go to the mall. Just go to the mall and go shopping. And I've gone into like a Bath and Body Works, and the girl that greeted me was so friendly and outgoing and not pushy and super sweet. And I offered her a job. She was working on the weekends. Hey, how about the dental industry? You get good benefits. It's 9 to 5. You're serving others here. You're just serving others in a different way. You get weekends off. It's a nice gig. So yes, I totally agree with you. And I actually have a Nordstrom background. So I love that you said that. And I think I attribute a lot of my sales and my customer service, but just being in the business of serving others. And I think that they really kind of brought home that during the whole training process. So we are in the dental industry. We really are in the business of serving others, and you need to find the people that want to serve their team and serve their patients in a way that is going to really just make a mark on them. Did we talk about that last time?
I think I read it, but I like Nordstrom's and that, like employees who have worked in some form of higher end area, because one of the things that we see on the phones when we listen to phone calls is the person who's answering those questions and presenting treatment is presenting treatment as if they kind of based on their financial level instead of, you know, someone who's been trained to be like, well, of course you can afford this. You're here,
Yeah.
whether you can or you can't is not. I'm going to present the treatment as if everyone should not just can afford it, but should be. This is where you should be putting your money.
Yeah.
And I think that's one of those soft skills that
Hmm.
the Nordstroms of the world develop very well in when it comes to case presentation and
Yeah.
answering questions around value of the practice and things like that.
Right. Yeah, I think on that topic is one thing that I really try to work with my treatment coordinators on is I try to let them know, you're not just selling a crown or braces or clear aligners. You really are selling that relationship, and you have to ask that patient the right questions so that you can be a great, I call it like a sleuth or a detective, to learn what their goals are and what their values are. Just like if you were to go in a Nordstrom, they're going to ask you, what are you looking for today? What is the event that you're shopping for? They're asking all the right questions so that they can guide them into exactly what they want. So when a patient comes in, and I encourage, this is from the moment that patient calls and wants to schedule a consultation, that dialogue starts then. What are you looking for? Have you been to a consultation before? What are the values? What are your chief concerns? What's going to bring you in to see us? You have to know everything about them so that you can check all those boxes for them so that the treatment pretty much sells itself because you answered all their questions and then you're going to give them a great experience.
No, I like that a lot. I'm about to now talk out of both sides of my mouth, and I need to be careful. On one hand, I want the best team available and I want to hold people accountable. On the other hand, I know practice is out there saying I have so much more free time to have someone fill it. Like, how do you bridge the gap between my team is telling me they're so busy, I can hear they're busy, to I'm now going to replace this person and go through a search? Like, how do you bridge that gap with your offices in kind of tying it back to accountability? Because I can hear someone talk to my patients and know they're not doing a great job.
Yeah.
But is it bad enough that it's costing me business? Yes, it is. I just don't want to face it. But how do I go from one to the other there?
Yeah, I'll give you one example. Most practices are going to have like an admin day or a non-doctor day. And I have chatted with doctors before, and they have their full team is there on a non-doctor day, and they might have a couple of emergencies that come in. But I'm thinking, okay, you've got what, 6, 7, 8 team members that are all there putting in a 6 to 8 hour day. Okay, let's do the math. How many hours is that? Like, really, what are they doing? You don't need 60 hours to stock chairs and dust and clean the floor and check in your boxes of Invisalign from UPS. So I think one is doing, really evaluating those admin non-doctor days. I always say when the cat's away, the mice will play. So what are they doing? And do you have leaders that are there in your absence who are your ally and not necessarily, gonna milk the clock with the rest of the employees on the team? And also, are there appointments within your doctor days that could shift to a non-doctor day or admin day to free up time in your clinic for those really important productive, whether it's a start or, full set of veneers or whatever the case may be. And then another suggestion is do maybe a time study of look at your block schedule and look at how much time you're allotting for these different types of appointments, and make sure, like, I recommend doing that twice a year, especially if you've got new team members coming in. You might have this group of assistants who are super quick and fast, and you may have this other group of assistants who maybe weren't onboarded or trained properly and they're really, really slow. So that doesn't necessarily mean like lengthen the time of those appointments. Is okay, maybe we need to invest in these team members and get them trained properly so they could be up here, and that's going to help with running a lot more efficiently as well.
So yeah, look specifically at all the things going on and find the time in the aggregate, I guess, versus just a singular example. No, very
Yeah.
well, very good set. Shelley, bring us home. What are 3 points you'd want to, if you had to summarize our session here today, what are the big three someone needs to take away here?
Big three is
Hmm.
clear job expectations. If you don't have them, you need to write them and create them. I can help with that. Number two is make sure that you've got standard procedure of operations for every single role within your practice. Every morning, what are we doing? Before you go to lunch, you have to do this. Come back from lunch, you do this. Before you leave at the end of the day, do that. Maybe your TC runs this report every Monday for your like pending list, whatever it is, making sure that you've got checks and balances for every single day for every single person. And then number three is if you know that you have given everything you can to this employee who maybe isn't performing optimally, you've given them the clear expectations, they know exactly what their job is, you've given them the tools and training to be successful, and they're still not doing it, you need to be comfortable with letting them go. And know, as we talked about earlier, that your team as a whole, that it's really going to be okay. Don't be scared. It's really going to be fine. You're going to have some superstars kind of step into that role, and you're going to wonder, why did I wait so long to let that person go? Because look at Brittany. She just stepped into that role and she is rocking it and so much more efficient. And it's important through the eyes of your team as a whole. If you are allowing that bad behavior to happen, you might end up losing a little bit of respect from your team, and they're going to fall into those bad habits as well.
Thank you so much. As always, I enjoy our time together, and you're out there doing good work and helping dentists be successful, which always makes me happy. Everyone, this is Shelley Bostrom, Align My Practice. I'll put a link to your socials and your website for folks to get in touch with you. And if you want more of Shelley, you need to go check her out online. She's amazing.
Thank you, Eric. It was fun to be with you today.